The American Red Cross reporting a severe blood shortage, and they are urging people to roll up their sleeves and donate now to help prevent delays in medical care for patients nationwide. But you know what? It's even worse here in the Northeast because we've had more bad weather and we have more incidents of flu. Hospital requests for blood supplies exceeding supply, with the nation's blood inventory down about 35% in the past month alone. So we've had a tough flu season. We've had the winter storms, all making things worse. Hospitals are being forced in many cases to triage blood products. Dr. Courtney Lawrence is Division Chief Medical Officer at the American Red Cross. She joins us with more. We say good morning to you, Dr. Lawrence.
Good morning, Ken.
Well, it's good to have you on with us. I spent about 20 years as a every few month blood donor, and then they put me on. I have AFib, so I'm on blood thinners and I'm on a finasteride. So as a result, I'm told unless you're off it for a few months, can't donate. It breaks my heart because I used to love to donate, and I wish more people would get into the habit. Even if you donate once a year, twice a year at the holidays, right? Just to get people in that habit. So is it the weather now and the flu and everything else that's keeping people away?
That's absolutely right, Ken. And one, thank you for having been a blood donor. And it's equally important to have people who are getting the messaging out how important blood donation is. So if you know that you yourself are not eligible to donate, but you're telling your friends and family about the need for blood, that is hugely important. So, in recent weeks, the hospital demand, the patient need for blood has really outpaced the Red Cross's ability to keep a healthy and robust blood supply for the entire nation. And you're absolutely right. We are experiencing the worst flu season that we've had in the last 20 years. And with a large number of people out in the community who are feeling ill themselves or taking care of their sick family members, they're just not able to come in and donate during that period.
Dr. Lawrence, I mean, is January normally a time when we have a shortage? Is that why January is blood donation month? Is that the reason to try to encourage people right now to donate?
Absolutely, we expect that every year during the winter months, we're going to have some unique challenges because there will be periods where, in certain places throughout the country, it's just not safe for donors to travel and to see us. However, we've really experienced the worst of it this winter season. So, this past December, about three times the number of drives were shortened or canceled compared to December of the year prior due to inclement weather. And just this past weekend alone, more than 400 drives had to be closed between Oklahoma and Maine due to Fern and the subsequent winter weather. And that really equals 10,000 plus blood and platelet units that weren't able to be collected for patients.
Oh, that is awful. So that is so tragic. So many people need it. Hey, you have, God forbid, an accident. Some people lose a lot of blood in a serious car accident. They need multiple pints of transfusion. So this is critical to save somebody's life, and it's almost obscene in this era that somebody could potentially lose their lives because there aren't enough donations. It doesn't seem like reality, but it sure is, right? And why not donate, I should say, why not organize a blood drive at your company? It's easy to do. I used to work for a radio station in central Hudson Valley, New York, and we used to do an annual one. Just the truck would come to us and we'd get 15, 20, 25 people would schedule right there at work. It would take a few hours to get all those people to donate, but it's such an easy thing to do, right? What do they just contact the American Red Cross to set that up?
That's absolutely right, Ken. And we so appreciate people who are willing to sponsor blood drives on the behalf of Red Cross. But for anybody who's interested in donating, it's as easy as going to redcrossblood.org and looking for the closest blood drive that's sponsored to their zip code and location.
Yeah, there's even I live halftime in South Florida and halftime here, and there are a couple of movie theater chains in South Florida that offer deals where if you go donate the pint of blood, they have the bloodmobile right there at the movie theater. If you donate the pint of blood, they'll give you some movie tickets. Anything to just urge people to go check it out. By the way, doesn't hurt. It's a pinch for a second. You lay down there, you relax, everything's good. You get a cup of juice or a candy bar, whatever afterward, you're fine, and you've saved a life. It's the feeling, the reward it's cathartic in knowing that, you know, 20 minutes of your time could have saved a human being, and all you did was lay there. So you're not being asked to go and fight a fire to save a human life. I'm just curious as to why everyone doesn't automatically understand that. That is it that people are just afraid of needles?
I think it's a couple factors. I think really it is the fear of the unknown, and I appreciate you saying that, Ken. That really it is an easy process. Really, we want people who are coming in to donate to feel comfortable and to feel their best, and so that's why we recommend scheduling an appointment so that you know that you have some time to prepare, making sure they're getting a good night's sleep the night before they come in. We want them to eat a healthy meal when they come in to donate, so it's different than when you're going to your blood doctor's office and getting blood work drawn where they might say fast. We don't want you to fast coming into the Red Cross donation site. We want you to hydrate, so that always helps, making sure that you have plenty of water on board so that you can recover most quickly, and bringing what helps you feel comfortable. So wearing comfortable clothing, easy to roll up a sleeve, and bringing a book, bringing your earbuds to listen to your favorite music. Our staff will help make people feel comfortable and explain what's happening throughout the process. But all of those other small things can really set people up for success.
Yeah, and it's probably a good idea if you're a parent, tell your kids from when they're young. I guess you have to be 16, right? 16 and in good health to start donating, and up until 64, is it?
So it depends on your state in terms of the lower age limit. In some states, it's 16, and in some states, it's 17 years of age. And there is no upper age limit on
Oh,
donating blood. So if you are feeling otherwise healthy and well, then you are eligible to make an appointment and be screened for blood donation.
good deal. And it's like 20 to 30 minutes. It's so easy. And again, like I said, you save a life. And if you're a parent, a young parent, teach your kids. Make that. So I know parents who make sure their kids know that at the holidays they should go volunteer or even year-round volunteer. Make this part of the process, right? Teach your kids that blood donation should be a responsibility that we do as a fellow human being to help save other lives. Just so important to do. What's the website once again, Doctor?
Sure. It's redcrossblood.org.
We are seriously in a lack of supply right now nationwide. Think about it. The pint of blood you donate today could go to save your next door neighbor, your relative, your friend tomorrow. It is very, very important that you take the time to donate. All right, the American Red Cross, just a wonderful organization and there to save lives for Americans. Dr. Courtney Lawrence, Division Chief Medical Officer at the American Red Cross. We thank you for joining us this morning.
Thank you, Ken.